I'm knocking on the door. I'm performing hand hygiene. Hello, my name's Desire. I'm going to be your student nurse for today. Just need to make sure that I am in the correct room with the correct patient. So can I get your first and your last name?
Michaela Paredes.
Okay, perfect. And what is your date of birth, Michaela?
12/28/05.
Okay, I'm checking her armband, making sure that I'm in the right room with the correct patient. Also observing the room, making sure that it's safe for this patient. And I am going to provide privacy. Okay, close the curtain. Okay, Michaela, so today we are going to be doing a physical assessment. That's just making sure that everything in your body is working properly. Is that okay with you? Okay, perfect. So to start off our physical assessment, just gonna ask you some questions. Is that fine? Okay, so do you know where you are?
The hospital.
Okay. And do you know what today's date is?
October 21st.
Okay. And do you know what year we're in?
2020.
And do you know who our current president is?
Sure.
Okay, perfect. So the patient is alert and oriented times 4. Hey, Michaela, are you experiencing any pain today? Nope. On a scale of 1 to 0, 0 being no pain, 10 being the worst pain, what is your pain at right now?
0.
Perfect. Okay, so we're going to start our assessment now. I'm going to start by taking your vital signs. So I took her vital signs. Her blood pressure was 120/80. Perfect. Her respirations were at 16 within normal limits. Her heart rate was between 60 and 100. It was 80, and her temperature was 98.6. Okay, so now I am going to start work my way head to toe. Is that fine with you? Okay, so I am looking at the face. I am looking at her skin color, making sure it's appropriate for ethnicity. I'm looking to see if her face is symmetrical. Her eyes are symmetrical. Okay, can you smile for me? Perfect. Smile is symmetrical as well. There is no signs of any facial drooping. I'm looking at her nose, making sure she doesn't have any drainage. Is it okay if I touch you? Okay, so I am going to pull her hair back, looking at the ears, inspecting the ears, making sure that they are both symmetrical to each other as well. Also noting to see if there's any drainage coming from them. Okay. Can you please open your mouth? Okay, can you say ah? Okay, perfect. So everything seems to be fine with her face. Is it okay if I palpate your head to see if I feel any lesions or bumps? Okay. So I'm palpating the head, making sure that she doesn't have any lesions or bumps in it. I'm also inspecting it. Everything seems to be fine. Was there any tenderness when I palpated your head?
No.
Nope. Okay, so now I'm going to look at the eyes. I'm going to use my pin light and I'm going to shine my light in them, okay? Okay, perfect. Pupils are reactive. I'm going to need you to follow the pen, okay? Perfect. Perfect. All right, so next what I'm going to be looking at is your chest. Is it okay if I expose of your chest? Yes? Okay, so if we were in the hospital, I would pull down her gown. I'm gonna pull down your gown. Okay, so I am inspecting the chest, making sure that her chest is symmetrical, that she's not using any symmetrical muscles or accessory muscles. I'm noting the color. It's appropriate for ethnicity. I'm also seeing if she has any cuts, bruises, or lesions, which she doesn't. I am going to feel for skin trigger. I'm going to pull on your skin, okay? Just making sure that you're not dehydrated. Perfect. This patient is not dehydrated. So next, I am going to listen to your heart sounds. Is that okay with you? Okay. So I am going to listen to her heart sounds. Okay, I am listening to the aortic, which is on the right side, second intercostal space. Perfect. Okay, and next I am listening to the pulmonic, which is on the left side, second intercostal space. Herb's point, which is third on the left side, third intercostal space. Perfect. Okay. And now I'm on the tricuspid, which is on the left side, fifth intercostal space. Okay, and then I am going to listen to the mitral, which is in the fifth intercostal space on the left side, mid. Okay, now I'm going to listen to her apical pulse, and I'm going to compare it with her radial pulse. Okay, and they were both bilateral, didn't hear any murmurs or anything like that. So now I'm going to listen to your lung sounds, okay? Every time I move my stethoscope, I want you to take a deep breath in and out, okay? Okay, perfect. Deep breath in. Okay. 2, 3, 4, 5, 6. Okay, perfect. Her breath sounded normal. I didn't hear any crackles, wheezes, or rhonchi. So now I'm just gonna listen to you in the back, okay? Same thing every time I move my stethoscope. Breathe in and breathe out, okay? 1, 2, 3, 4, sit up. 5, 6, 7, 8, 9. Okay, perfect. So didn't hear any crackles, wheezes, or rhonchi on the posterior side either. So now I'm going to put your gown back up. You can go ahead and lay back for me. Now I am going to be checking your abdomen. Is it okay if I expose your abdomen? Okay, perfect. So I'm going to pick up your shirt. I'm looking at the abdomen. I'm noting the contour of the abdomen. I'm seeing if she has any cuts, bruises, or lesions. If she had any tubes, I would inspect the tubes for any signs of infection, any redness. She doesn't. So now I am going to auscultate. I'm going to auscultate your bowel sounds starting in the right upper quadrant, okay? And I make sure I'm listening between 5 and 30 bowel sounds. Okay, so I'm gonna start in the right upper quadrant, listening for a full minute in each quadrant. Okay, and I listened. You don't have hypo or hyperactive bowel sounds. Everything seems to be normal. So now I am going to check your strength, okay? Before I do that, I'm going to look at your fingernails and I'm going to check for capillary refill, making sure that it's less than 3 seconds in all your fingers. Okay, all of them are less than 3 seconds. So what I'm going to have you do now is I'm going to put my 2 fingers here and I want you to squeeze them as hard as you can. Perfect, strength is equal. Now I'm going to have you grab onto my hand and I want you to pull up. Okay, perfect. Strength is equal here as well. And if I couldn't find a skin turgor on her chest, I would check it here on the arm, which is perfect as well. No signs of dehydration. Okay, so now we're gonna go to your lower extremities. Is that okay? Okay, so now we are on your lower extremities. I am going to check the color, making sure it's appropriate for ethnicity, making sure you don't have any cuts, bruises, or lesions. I'm going to check for peripheral edema, which you don't have any. I'm going to palpate your pulses on your feet. I'm going to feel for your PD dorsalis. I found both of them and they are both equal. If I couldn't find these, I would use a Doppler machine. I'm also going to feel for your posterior tibialis, the inside of the feet. palpating them, making sure that they are both equal as well, which they are. I'm going to check for capillary refill in the toes too. If they had nail polish, I would check on the top of their toe. Okay, your capillary refill is less than 3 seconds. Now I am just going to check your strength in your feet. Okay, so can you pull up for me? Good job. Now pull down like you're pushing. There you go. Same with this one. Pull up. Good job. Push down. Okay, now I'm going to lift your leg. I want you to push down on your leg for me. Good job. And I want you to push up. Good job. Again with this leg, push down, push up. Perfect. Good sign of all your muscles. All right, Michaela. Well, I think that completes my physical assessment. Do you have any questions for me? No? Okay. Well, I will be back in about 30 minutes to an hour just to observe you, making sure everything is okay. Here is your call light. Press this button if you need me. And here's your phone. Call me on your phone if you need me. Okay? Okay, so that completes my physical assessment. And yeah, I will perform hand hygiene and walk out the door.